Right now, I want to present to you Reverend Dean Nelson. Reverend Nelson is the Vice President for Underserved Outreach at CareNet, the Chairman of the Frederick Douglass Foundation, and is an executive leader with over 20 years of experience in ministry and over 10 years in political activism on local, state, and national levels. He has extensive experience working with leaders in the African American community and is passionately committed to promoting a culture of life. Dean has served as the executive director for the Network of Politically Active Christians and as vice president for the Frederick Douglass Foundation. Under his leadership, both organizations inform thousands of faith leaders of relevant political developments and train hundreds in biblical worldview and public policy. Reverend Nelson is a licensed minister from Salem Baptist Church and is an ordained pastor with Wellington Boone Ministries. He is a devoted husband and father. Ladies and gentlemen, please welcome Reverend Dean Nelson.
Good afternoon. For the next few moments, I'm going to talk about what has been called the billion-dollar lie. I was 14 years old, said Timely, when I found out that I was pregnant. I knew that if I told my mom, she would be extremely mad. And when my mother did find out, she angrily told me that I was going to get an abortion. She took me to an abortion clinic. They didn't ask questions. They just told us how to schedule an appointment and sent us and how much it would cost. A little intimidated by the price, my mom thought that she would look around. She called and made an appointment at another abortion clinic. A few days later, my mom took me to that clinic and paid the $470 fee for that particular abortion. She was not allowed to come into the room with me, so I walked through those doors with strangers. I felt scared and completely alone. They did a quick orientation and they told me what was going to happen. They then did an ultrasound. They kept the machine away from me so that I could not see what was on the screen. The doctor came in, but before they started the procedure, one of the women from the clinic also came in and spoke with the doctor. The woman told me that they were not going to be able to do the procedure. She told me to put my clothes back on because they had determined that I was 5 months along. They determined that by being 5 months along, I was further than they had originally thought, and that I would need to come up with more money for this necessary procedure. When I got back to the waiting room, I told my mom what had happened. She went to the registration desk, and a few seconds later, she turned around and told me that we were leaving. I was so relieved. She didn't ask for her money back. She just grabbed my hand and we left. She kept telling me how sorry she was. She later told me that she had seen my file on the desk, and included in my file was an ultrasound of my baby. The following week, we went to a local pregnancy help center. They were anxious to help us in any way that they could. They offered maternity clothes, material assistance, a crib for my baby, and lots of referrals to local agencies. I am so thankful for everything that they did. On January 7th, I gave birth to Damien. He was 2 months premature and weighed only 2 pounds at birth. But God saw us through it, and today he is 6 months old and completely healthy, receiving all the love and attention that God had planned for his life. This story has a positive ending. However, the harsh reality is that most young women, particularly minority women, are targeted by this multi-billion-dollar-a-year enterprise that skillfully and deceitfully markets and promotes itself as being for women's health. The reality, however, is far from the truth. Not only is abortion a cold, somber procedure that extinguishes the life of a tiny human being, it also robs women of their dignity. It's no wonder that 81% of women surveyed in a report of the Journal of Social Issues said that they felt victimized by the process of abortion and that they were either coerced into the abortion or that the information about alternatives or the actual abortion procedure had been withheld. In fact, forced abortions in America showed that there are 64% of women obtaining abortions that they were actually coerced into that decision. An article in the American Journal of Obstetrics and Gynecology revealed that black women and other minority women are 2.5 times more likely than white women to actually die of an abortion. Women continue to be manipulated, misinformed, and hurt, and even die, largely because this industry is more concerned about making billions of dollars than they are with women's health. The Alan Guttmacher Institute, the research arm of Planned Parenthood, estimates that there were 1.21 million abortions performed in the United States in the year of 2008. In 2009, the average cost of a non-hospital abortion with local anesthesia at 10 weeks of gestation was $451. The Women's Medical Center estimates that second trimester abortions cost up to $3,000, with the price increasing further along as the pregnancy goes. That means each year in the United States, the abortion industry brings in approximately $831 million. This does not even include the $337 million that Planned Parenthood receives annually in government grants and contracts. If you add those numbers up, the dollar figure is well past $1 million. In an interview with a former abortionist, Carol Everett, she states that she was never concerned about women's health. She wanted to make money. Abortion, she says, is a lucrative business. It is the largest unregulated surgical industry in our nation. We don't really care much about counseling. We sold abortions. She says that we had a whole plan to sell abortions. It was called sex education. Break down the natural modesty of a child, separate them from their parents and their values, and become the sex experts in their lives. She said that they would often give low-dose birth control pills and that they would offer defective condoms so that girls would get pregnant. Our goal, she said, was 3 to 5 abortions from every girl between the ages of 13 and 18. Consider Dr. Laverne Tolbert, who states that there's no other place that has been more strategically implemented for this process than in the urban communities. She said, and she was the former board member of Planned Parenthood in New York City. She said, I've seen firsthand that women in our communities where blacks reside are strategically targeted by Planned Parenthood. Children who attend inner-city schools are sexualized at a young age through school-based health centers and comprehensive sex education classes. She says this is part of their manipulative scheme. While the pro-abortion advocates often say that they want to reduce unwanted pregnancies and abortion through sex ed and contraception, the conveniently ignored fact is that legalized abortion and hormonal birth control actually lead to higher STD rates, according to a George Mason University study. They examined over 4 decades of STD data state by state and found that legalized abortion could account for as much as 1/3 of all new infections. Abortion groups like Planned Parenthood continue to get government grants in the millions of dollars to fund initiatives to lower unintended pregnancy rates, yet with all this funding, still the rates have been unchanged since 1995. In fact, the Department of Health and Human Services has significantly reduced their goals because they realize that these programs simply do not work. It is just a scam to keep the government dollars coming for their real product, which is abortion. Perhaps the most shocking trend in the abortion industry is not only to push abortions on those in black and urban communities, but to attack any organization that provides an alternative. Over the past several years, abortion businesses and their lobbyists have teamed up with pro-abortion legislators to push unconstitutional disclaimer bills in several states like Maryland, New Mexico, Oregon, and Virginia. While most of these bills have been unsuccessful, the abortion industry has not been deterred. They have actually now, through several cities like Baltimore, New York, and Austin, Texas, pushed for ordinances that would force pregnancy help centers out of business. These laws would place heavy fines, regulations, and even jail time for PRC staffers for just providing alternatives to abortion. For every woman who decides to visit a pregnancy center and to help her and to keep her unborn child, the abortionist loses up to $3,000. If most abortions occur in the urban sector, the abortion clinic in those areas are simply protecting their bottom line. Sadly, these pregnancy centers provide a variety of services. They provide free ultrasounds, free pregnancy tests, counseling, and material assistance for the women who are most in need. According to NARAL Pro-Choice, these attacks are not isolated incidents, but rather a premeditated plot against only pregnancy centers in urban communities. A report on pregnancy centers in 2010 from the Family Research Council demonstrates, however, that PRCs have served over 2.3 million people through a variety of services with little or no cost. It is estimated that the cost savings of these centers has been over $100 million to these communities. It is estimated that there are about 2,000 of these pregnancy centers in the United States. These centers have consulted with over 963,000 new clients, given 720,000 pregnancy tests, performed over 230 ultrasounds, and seen almost 1.5 million students in abstinence classes, and have provided 292,000 clients with parenting classes. While the abortion advocates call themselves pro-choice and pro-women, it is clear from their tactics that they are not. This billion-dollar, under-regulated industry wages the real war on women. They are more concerned with protecting their financial interest than they are with protecting women. By contrast, the growing number of pregnancy centers is continuing to provide helpful services that bless women in their communities. Whether it is abortion recovery programs, parenting classes, abstinence education, STD testing, ultrasounds, or even medical exams, these pregnancy help centers have been a productive support in their community. A report from Time magazine on pregnancy centers said it best, that they are becoming the kind, calm, non-judgmental face to vulnerable women who find themselves in need. Thank you.